Tonight, there's good news here at home and across the country. COVID hospitalizations have dipped to near record lows. Hospital admissions for COVID-19 related illnesses have fallen 32% in the last 2 weeks. Wyoming, by the way, has the lowest rate of COVID hospitalizations nationwide. Only 9 patients there yesterday. By the way, by comparison, in Southeast Texas, we have a total of 10. Now, since March of 2020, when HHS started recording hospitalization data, there were days when as many as 159,000 people were in the hospital with COVID. By the way, the peak January of 2021 during the Omicron surge. You know, access to free COVID testing and treatment, it's been a cornerstone of the Biden administration's plan to deal with the pandemic. But has that ended for millions of Americans? Ariane Daytil verifies.
As some medical experts warned that another COVID-19 surge could be on the way, on Twitter, Dr. Adam Gaffney, a critical care doctor and assistant professor at Harvard Medical School, claimed that uninsured Americans no longer have federal coverage for COVID-19 treatment and testing. An estimated 31 million people in the United States were uninsured in the first 6 months of 2021. So let's verify. Has federal coverage for COVID-19 treatment and testing for uninsured Americans ended? Our sources are the White House, HR 2471, the U.S. Health Resources and Services Administration, and Quest Diagnostics. Since March 2020, the federal government has spent trillions of dollars funding the nation's coronavirus response through the CARES Act and the American Rescue Plan. But the White House says that money is running out, and HR 2471, the new $1.5 trillion spending bill, doesn't allocate any money to this. As a consequence of funding not being renewed, the Health Resources and Services Administration said, quote, the uninsured program will stop accepting new claims for testing and treatment due to lack of sufficient funds, unquote. Quest Diagnostics, a medical lab company, has begun notifying its clients and partners that it is no longer expecting to be reimbursed for rapid and PCR testing through the program, unless, quote, additional funding is allocated, unquote. So we can verify, yes, federal coverage of COVID-19 testing and treatment for uninsured Americans has ended. With your Verify, I'm Ariane Daytil.
And if there's something you'd like us to verify, you can always send an email to verify@12newsnow.com. We'll also look for your direct messages on Facebook and Instagram.